Welcome to Learn with Nana. In this channel, I'll teach you about diagnostics, pathophysiology, respiratory care, and neonatal and pediatric respiratory care. Plus, I'd give you practice questions. To learn more about this, subscribe now, like this video, and comment your thoughts. Now let's proceed. We have learned in my previous video how to interpret arterial blood gas with oxygen support. Now the interpretation of the ABG result that I gave from my last video is uncompensated respiratory alkalosis with uncorrected hypoxemia. I hope that you get the right answer. Now let's proceed to what is the causes of the respiratory and metabolic acid-base imbalances. We know that a doctor orders some different tests to identify and to determine the patient's condition. From the results of the tests, the doctors and the healthcare providers could give possible diseases or conditions the patient have, also considering the patient's signs and symptoms. Now that we have mastered how to interpret ABG results, we can tell what causes this result and the signs and symptoms that the patient can manifest. That will be discussed in this video. First to discuss is respiratory acidosis. We know that the ABG result of the respiratory acidosis has a pH of 7.35 below and a PaCO2 of 45 above. Let me explain this whole topic briefly. The respiratory acidosis, or what we call the acute ventilatory failure, is occurring to the patient because the lungs can no longer work to excrete or to exhale the CO2 in the body. Thus, the CO2 is increased. And why is that so? Let's look at the causes. We have the COPD, atelectasis, respiratory failure, pneumonia, and asthma. These diseases targets the airways and the alveoli, which then makes it hard for the lungs to have proper ventilation and perfusion, thus the CO2 is dropped. Now what could be the signs and symptoms the patient manifests? In the early signs and symptoms, the patient may experience headache, anxiety, restlessness, and difficulty of breathing. It is because the exchanging of the gases, the carbon dioxide and the oxygen, is not achieved. Moving on to respiratory alkalosis. The ABG result of the respiratory alkalosis has the pH of above 7.45 and a PaCO2 of below 35. Now what causes the patient to have these results? We have here the causes: hypoxemia, hyperventilation, ventilator, and pain. Now, hypoxemia is the common cause of the respiratory alkalosis. Hypoxemia refers to the low level of oxygen in the blood. We know that the PaO2 has the normal of 80 to 100. Now, when the PaO2 reaches 60 and below, it stimulates the peripheral chemoreceptors, which then causes the ventilatory rate or the breathing of the patient to increase. Now the patient is hyperventilating. It is the rapid and deep breathing of the patient where in turn there is too much carbon dioxide exhaled. Now why is the ventilator one of the causes of the respiratory alkalosis? Now when the patient is on ventilator, the patient does not have control to its own breathing. So it can be that the set parameters on the ventilator, specifically the tidal volume and the respiratory rate, is too high that the patient exhales too much carbon dioxide. Next is the pain is included, because when the patient is in pain, the patient hyperventilates and leads to respiratory alkalosis. Now let's proceed to another acid-base imbalance. We have here the metabolic acidosis, where the pH is below 7.35 and the bicarbonate is below 22. Now what causes metabolic acidosis? We have here the diabetes mellitus, diarrhea, and renal failure. Let's talk about diabetes mellitus. Normally in a person, we have this hormone called insulin that brings the sugar from the blood to the cell to be kept or used as energy. Now in a patient with diabetes mellitus, its body does not produce enough insulin, or the insulin does not work well. Therefore, there is no energy produced since the sugar or glucose is in the blood and not in the cell. Now here why is the diabetes mellitus will have an ABG of metabolic acidosis? Because there are two ways. The first one is because of the ketones. Since there are no energy produced by the sugar, the fat in the body, instead of the carbs, will burn and it will turn into ketones. These ketones are acidic and that makes it metabolic acidosis. The second way is, remember that I have mentioned that hypoxemia is the common cause of respiratory alkalosis? Now in metabolic acidosis, it is commonly associated with acute hypoxemia. So the body will find a way to still meet tissue metabolism without using oxygen. And that is using the anaerobic metabolism, which then it results by producing lactic acids. Thus the acids are increased in the blood, thus the result metabolic acidosis. Other causes of metabolic acidosis is diarrhea and renal failure. In these two, there is loss of too much sodium bicarbonate in the body, thus leads to metabolic acidosis. It is different from the diabetes mellitus because it adds fixed acids in the body that results to metabolic acidosis. Now the signs and symptoms the patients manifest is nausea, lethargy, and may lead into coma. Now let's proceed to metabolic alkalosis, where the pH is above 7.45 and a bicarbonate of above 26. We have the causes here: vomiting, antacids, nasogastric suction, diuretics, excessive bicarbonate ingestion. In vomiting, the patient throws up gastric secretions. That gastric secretions are acids, thus a decrease in acids is an increase in alkalinity in the body. That gives the results metabolic alkalosis. Next is antacids. It is given to neutralize the stomach acidity because it is given to relieve the indigestion or upset on stomach. And the next one is nasogastric suction. It suctions the gastric secretions, therefore removing the acids in the body. Now, how diuretics lead to metabolic alkalosis? It can cause due to excretion of chloride in proportion to bicarbonate. In metabolic alkalosis, the patients manifest weakness, early tetany, mental dullness, increased deep tendon reflexes, and muscle twitching. That is all for the respiratory and metabolic acid-base imbalances. I hope that you learned and enjoyed my lesson. And if you have some questions, feel free to comment below. Now hit the subscribe and like, and I'll see you in the next video.